Hello everyone, I'm Anastasia signing in from Noras. In our previous session, as we have started discussing about bowel elimination, there we have got an idea about the normal and the abnormal characteristics, about the factors influencing as well as the various conditions that can lead to an alteration in the bowel elimination. In this session, we will be discussing about the types of stool tests. Here we will come to know what are the tests that we can perform in order to determine the abnormalities as well as to help in diagnosing the condition of the patient. Here, when we talk about these stool tests, there are two main tests from which we can choose. The first one is the fecal occult blood test, which can be done in order to determine the presence of blood in the feces. And the second one is the stool DNA test in order to determine the genetic material from polyps or even from the cancerous tumors. So this first test, which is the fecal occult blood test, is a test where a chemical agent would be used in order to detect the presence of blood. Here, this test is mainly done in order to check hidden or occult blood in the stool. And just by the presence of blood in the stool, it can give us an idea that there may be a bleeding in the digestive tract, which can be because of various conditions like ulcer, polyps, diverticulosis, because of presence of conditions such as colitis, hemorrhoids, or even colorectal cancer. So if any one of this condition a person is suffering from, then this could lead to presence of bleeding in the digestive tract, in which you would ultimately find that there will be presence of blood in the stool. So here, in order to detect this test can be done, which is the fecal occult blood test. There is also another test, which is the guaiac fecal occult blood test. So under this fecal occult blood test, the guaiac fecal occult blood test is the most commonly used or is the most commonly opted test in order to find out the presence of blood in the stool. And under this, the guaiac fecal occult blood test is the most commonest method which is used to detect the presence of blood in the stool. The main purpose of choosing the guaiac fecal occult blood test is that in this we would be using a guaiac, which is a reagent, in order to detect the presence of an occult blood which may appear from any non-specific source, or in which the signs and symptoms may be absent. So here, if the signs and symptoms is not visible, or if there is presence of blood in the stool from any non-specific source, then by the use of the guaiac as a reagent, we can determine the condition. The second one is the stool DNA test. So in this test, rather than looking for the presence of blood in the stool, here it would detect the genetic material that can be shed from polyps or cancerous tumor. Here it is important to note that the stool testing is only an effective colon cancer screening option when this test is used in combination with other methods. Once the stool test has been performed, if the result is positive, then it is important that you must book an appointment with a doctor, after which he or she would be advising you to perform a colonoscopy or any other similar test. This stool DNA test is mainly used as a method of screening for the presence of colon cancer or precancerous tumor if there is absence of any signs and symptoms. Because here, if a person is suffering from colon cancer or if he or she is having precancerous tumors, here there will be shedding of cells having an abnormal DNA in the stool. That is why this stool DNA test can be done in order to detect the genetic material. Here, the test will be considered positive if there is presence of abnormal DNA structure associated with polyps, with tumors, or even if there is traces of occult blood in the stool. However, if there is no abnormalities in the DNA structure, if there is no traces of the occult in the stool, then the test will be negative. The next one is the stool specimen or culture. This stool culture is the process of growing or culturing the organisms which is present in the feces in order to find out if they are causing any diseases or not. The most common is the ova and the parasite test, which is a microscopic examination in order to determine the presence of any parasites such as the amoeba or worms in the stool. The main purpose of performing this stool culture is to understand as well as treat the presence of any intestinal illness. It can confirm the presence of any harmful bacteria, what treatment may work in order to kill any invasive organism, and if no dangerous bacteria is present in the stool culture, but if there is still presence of signs and symptoms, then by performing the stool culture, it can help to explore as well as to diagnose various other conditions such as the inflammatory bowel syndrome or presence of any parasitic infection. And since I've said that the most commonly used test here is the ova and the parasite test. This is done in order to detect the presence of any parasite or of an ova in the stool, because here once this is detected, This test is mainly ordered if a person is experiencing any symptoms associated with intestinal infection, like the presence of blood or mucus in the stool, frequent diarrhea, fever, abdominal pain, headache, vomiting, or even nausea. So if a person is complaining of these symptoms, that is when an ova and a parasite test can be done. There's also another test known as the white blood cell test. This test, from the name itself, you can understand that this is mainly done in order to detect the presence of leukocyte or white blood cells in the stool sample. Although leukocytes helps the body to fight off infections, although it is a part of the immune system, but the presence of this leukocyte or the white blood cells in the stool sample may indicate bacterial infection. So this test will mainly be ordered by a physician if a patient is having the complaints of mucus or blood in the stool, watery diarrhea for more than 4 days, fever, abdominal pain, and even fatigue. The next one is the H. pylori antigen test. Here, the H. pylori or the Helicobacter pylori is a bacteria that is present in the digestive system. The presence of this H. pylori, some people may never have the symptoms of infection even though this H. pylori is infecting them. Whereas for some, it can cause many gastrointestinal disorders such as peptic ulcer, gastritis, or certain types of stomach cancer. The main purpose of performing this test is to detect the presence of H. pylori or the Helicobacter pylori in the digestive tract to check whether the digestive symptoms are caused by an infection and to determine whether the treatment for H. pylori is working or not. So this is the reason why the doctor may advise you to perform the H. pylori test. So now here we have come to the end of this topic, whereby in today's session we have discussed in detail about the types of stool tests. I hope you have got a clear understanding why these tests are performed, as well as what are the various causes, what are the disease condition that can lead one to suffer from various symptoms, and if a person is suffering from certain signs and symptoms, what are the tests that can be performed in order to diagnose the condition. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.